One of the injuries that we see with the shoulder is a tear of the rotator cuff. A lot of patients come into our office and complain about weakness in the shoulder and pain. Now with the advent of an MRI, we can tell if the shoulder rotator cuff is torn and how big the tear is and how fixable the tear is most times. So what we know now is that the rotator cuff doesn't have any ability to heal itself. So that if you start with a small rotator cuff tear and you don't fix it, within several years you'll have a larger rotator cuff tear. So the body can't heal the tear down. When we're doing arthroscopic surgery to repair the rotator cuff, and it can be done with you lying on your side or sitting up, we basically look into the joint with a camera. And what we find is that the tendon has actually torn off of the foot plate where it attaches. We use a little burr and make a little place to attach that tendon. And then we use some bioabsorbable anchors that go into the foot plate. And each of those anchors may have 1 or 2 sutures. And we put those sutures through the tendon, not at the end, but about 1 centimeter from the end. We then arthroscopically tie that part of the tendon down. So we may have 4 to 8 sutures at that point. We'll then take 1 suture from each pair across the remaining top of the rotator cuff and put another row of anchors on the outside. So we've actually hooked that tendon down with 2 separate suture rows. And by doing that, we lay the entire tendon across the foot plate, and the rates of healing are extremely high, like 90%.